Hello. Today we're going to discuss one of the hottest topics in veterinary medicine today, and that's the topic of vaccination. It's a controversial topic, but one that I hope to cover for you today in an outline form that can hopefully allow us to vaccinate more smartly and not ignorantly. My name is Dr. Michael Dim, and I'm a holistic veterinarian here in West Palm Beach, Florida. I offer inpatient consultations both in the home and in my home office, and I also offer nationwide consultations by phone. So, immunizations and vaccines, they've been the cornerstone of medical treatment in the veterinary profession, or I should say, preventative medical treatment for decades. They've often been given every 1 year, every 3 years. And the truth is that is overdone. About 50 years ago, Dr. Ron Schultz, a prestigious immunologist, published some studies on the fact that immunization to certain core viral vaccines, that the immunity lasts for years, if not the life of the animal. And his paper was actually republished in a textbook called Kirk's Current Veterinary Therapy, which was a textbook taught in all veterinary schools at the time. However, several decades later, my colleagues really haven't listened because over 60% of veterinarians still vaccinate every year in our animal patients. Now, vaccination is supposed to be an individualized process. In other words, if you have an indoor cat versus an outdoor cat, if you have a toy breed like a Yorkshire Terrier or a Maltese, or if you have a large breed like a Labrador that spends a lot of time out in the woods and hunting and running around outside versus those toy breeds which are inside, those animals have different risks for infectious disease. And so they shouldn't be vaccinated the same way. And the same could be true for also the dose of the vaccine. For many years, I always wondered, why would a small dog, like a Maltese or a Yorkie, get the same dose as a over 100-pound Great Dane? I noticed that reactions were occurring more in these toy breeds, and that became a topic of interest for those of us in holistic veterinary medicine. Several years ago, Dr. Gene Dodds, a prestigious hematologist, actually did a study on small dose vaccines in smaller animals. And she found that they were equally protected from certain core infectious diseases by cutting down on the dose and therefore cutting down on the risk of reactions in those smaller patients. So, that topic is really important. And the battle cry was actually carried on by a colleague of mine, Dr. John Robb, which many of you may know. And Dr. Robb actually put his license on the line by actually going to fight for the fact that smaller animals should be given smaller doses of vaccines. I'm actually almost lost his license. So this movement has really taken hold in veterinary medicine about individualized approaches to vaccine and smaller doses for smaller animals. Now, one of the most interesting topics about vaccinations is, what is a vaccine reaction in our animals? Unfortunately, veterinarians, like medical doctors, get next to no training on immunology in veterinary school. We actually graduate and actually think that if an animal doesn't have an immediate reaction in the exam room with swelling or vomiting and diarrhea right away or weakness, that vaccinations can't possibly have a role in illness. But immune reactions can occur hours, days, weeks, or months, or even years later in our animals. And that's been shown immunologically. In fact, in cats, certain cancers called sarcomas can appear at the site of the vaccination years later. And those are often very aggressive malignant cancers that can occur as a result of the feline leukemia virus vaccine or the rabies vaccine in our cats. So vaccine reactions are actually not rare. In fact, 85% of the reactions occur as a result of killed viral vaccines because those vaccines have the most adjuvants or preservatives in them, and as well as heavy metals like arsenic or mercury or aluminum. So we have to be very mindful with the killed viral vaccines, of course, which one of the major ones that are given is the rabies vaccine. The other aspect of vaccination reaction is to understand that a lot of reactions occur when the gut is imbalanced, when there's not a healthy microbiome in the digestive tract. We spoke last time about the role a leaky gut plays in immune reactions throughout the body. And so it's not surprising that if the gut is not in a healthy state, that vaccine reactions are going to be increased dramatically. Also, vaccine reactions are increased in neutered or spayed animals. We spoke last time about how how animals that are spayed, animals that are not spayed and not neutered, by maintaining the sex hormones, have plenty of health benefits, including less chronic disease as well as less immune reactions to vaccinations. Vaccination reactions, as they occur, can affect many different organ systems. A colleague of mine, Dr. Larry Glickman, published a couple of decades ago about how certain animals, when they were given multivalent or multi-combination vaccines, developed antibodies against their own tissues, such as the thyroid gland, the DNA of the animals, which is actually pretty surprising, the collagen or the glue or the connective tissue of the body, as well as even the heart valves in our animals. And so when we develop antibodies against those tissues, the incidence of immune diseases down the road is significantly increased. Animals that are given multi-combination vaccinations are actually more predisposed to increased allergies to grass and dander and ragweed and pollens. And that leads to increased skin infections and ear infections and dogs that are scratching and chewing and licking at themselves. And so that's one of the most common presentations at the veterinary clinic. And a lot of the times it's exacerbated by over-vaccination in our animals. Homeopathic vaccinosis is actually the mental, emotional, and chronic physical symptom changes that occur as a result of the vaccination process. So, for example, when we have animals that are vaccinated for an acute digestive virus like parvo, you may be protecting animals against an acute disease, but by injecting the vaccine component and all of the adjuvants with it, you actually develop chronic changes such as chronic diarrhea tendencies or chronic vomiting. And we call that vaccinosis. Animals that are vaccinated with rabies, for example, develop chronic symptoms of actually what rabies looks like in the wild populations. We see a lot of neurologic disorders. We see behavioral changes, anxieties, even paralysis of the lower legs as a result of the chronic effects of rabies vaccine. Animals often develop separation anxiety. They develop odd symptoms like reverse sneezing or increased sexual desire seen in the neutered animal. And all of those symptoms are actually symptoms of the actual disease, rabies. So chronic vaccinosis is a definite problem in our animals. The next topic I want to talk about is what, if any, do we want to vaccinate our animals for? As a holistic veterinarian, I actually focus more on the terrain of the patient. What I mean by that is making the individual's health stronger and less susceptible to chronic disease, including infections and parasites. That's a different approach than trying to combat the outside agents in disease. But talking about vaccinations, we want to look at susceptible populations to infectious disease. We want to look at whether a vaccine is safe, whether it's effective, or whether there are potential long-term side effects, and whether they're even needed in our animals. So looking at the susceptible populations, we want to look at puppies and kittens. They are certainly more predisposed to infectious disease, but their young immune systems are developing. Veterinarians throughout the country vaccinate animals starting at 4 to 6 weeks of age and do it every 2 to 3 weeks up until they're 4 months of age. And the truth is that those early vaccinations don't even take, meaning that they're not even stimulating an immune response, because a lot of these puppies and kittens have antibodies from their mother's milk that interfere with the vaccination process. So giving over-vaccination to these young animals actually exacerbates immune disease and doesn't really protect them. So as a minimalist in vaccination, I usually recommend waiting till those animals are 16 to 18 weeks of age and then give a single vaccination. And I try, if I possibly can, not to give multi-component vaccines at the same time. So there are certain core vaccines that are known as, vaccines that immunologists recommend that all puppies and kittens should receive. And then there are non-core vaccines. The non-core vaccines, which really shouldn't be given, in my opinion, are vaccinations like kennel cough, Lyme disease, leptospirosis, canine influenza, These viral vaccines or bacterial vaccines really have no role in protecting animals, and actually, many of them aren't even safe. As far as our puppies and kittens, the main viruses I recommend vaccinating them for are canine parvovirus and kitty parvovirus, if you're going to vaccinate. There are other options as well, which I'll get into in a minute. So, parvovirus is an intestinal virus that can cause severe diarrhea, vomiting, dehydration, and even early death if an animal is severely affected. So that's one that a guardian would consider vaccinating for. And kitty cats also have their own version of a parvovirus called kitty panleukopenia. So those are two viruses that people can consider vaccinating for. I tell clients to try and avoid the multi-component vaccines because the more components in a single injection, the more likelihood of immune reactions, as well as the more injections that are given at the same time. Most of the other core viruses that a lot of the immunologists recommend, I don't use in general practice. Canine distemper is a measles virus that it goes back many generations in our dogs. However, most dogs that are exposed to the measles virus, distemper, get very mild symptoms. They may get a mild respiratory infection. They may be slightly off, but I don't find them getting severe pneumonias or seizure disorders like many of my colleagues point out. And so many years ago, they used to have actually measles parties for children so that children can get together and get measles and get it over with so that they would have lifetime immunity. One of my colleagues actually does that with dogs. She'll actually get dogs together in a park, a local park where distemper has been found in raccoons, and have the animals actually have a little distemper party where they'll actually, kind of congregate, be exposed, and develop their own innate lifetime immunity. So distemper is a virus I don't recommend vaccinating for, even though it's in many of these components of these multivalent vaccines. Rabies is a vaccine that is required by law. I usually wait until animals are 5 to 6 months of age to give it, and I always separate the vaccines if they're given. Rabies, the immunity to rabies, actually also lasts many, many years. There was a study that just was completed called the Rabies Challenge Fund, which documented long-term immunity way beyond what's legally required. However, we do have to follow the law with rabies, but there are certain states that allow rabies exemptions. And hopefully in the future, they'll actually allow the measurements of what are called rabies vaccination titers, which are another way of documenting protection against certain infectious diseases. Animals, as they get older, middle age, and senior animals, their need for vaccination goes way down due to the long-term immunity from those earlier shots. What veterinarians should be stressing in middle age and senior animals is a wellness visit where a complete physical exam can be done and a dental exam. And if needed, blood work should be done to check vital organ function and to pick up on early disease. So that's a little chapter on infectious diseases in our animals and which ones we should consider vaccinating for. And again, we want to stress wellness visits and blood work and dental exams rather than the vaccination process. So what if your animal gets vaccinosis or acute or chronic disease from vaccines? What can we do about it? Are there any treatments for it? What I do in my holistic practice, if clients decide to vaccinate, is I'll have them give certain homeopathic remedies at the time of vaccination to hopefully lessen the likelihood of reaction. One of them is called thuja, and that's a really important homeopathic remedy that I'll often have clients use for 3 days following a vaccination, a routine vaccination. For rabies vaccine, I'll often recommend the homeopathic remedy Listen, which is another remedy that was made from actually rabid material. And when it's homeopathically prepared, it sometimes can prevent vaccine reactions. There are other homeopathic remedies that are individualized for each patient, and those are best prescribed by a trained and experienced veterinary homeopath. The other sorts of treatments that I'll use in animals that are affected by vaccines or even as a preventative is I'll put animals on like a liver detox. In other words, to help filter out the toxins that come with the vaccines. I often use various liver cleanses from good companies like My Paleo Pet down here in South Florida, as well as another company I use up in Maine known as Sustenance Herbs. And they have some excellent products along with chlorella and spirulina, two species of algae that are very, very good for decreasing heavy metal contamination from the vaccines. I also will use in practice antioxidants. Antioxidants go a long way in decreasing inflammation and what is known as free radical damage as a result of toxic insults on the body. There's an excellent company I use called VetraScience that has a product called Cell Advance that I'll often incorporate into preventing and treating vaccinosis. And finally, there's an immune modulating agent known as dimethylglycine or DMG that I'll often incorporate into my treatment of vaccinosis. So what are the alternatives to vaccines? I mentioned a little earlier about titers. Titers are antibodies that can be measured in the bloodstream as a result of either exposure to natural disease or as a result of the vaccination process. And what's been shown is that the immune system has what's known as immune memory. And that means that from earlier vaccinations, the one or two that I suggested early on, that those antibodies that indicate protection last for many, many years. And that's a wonderful alternative than to blindly vaccinating animals for infectious diseases that are not even needed. The other option we can use are what are called homeopathic nosodes. I mentioned one earlier known as Listen for rabies vaccine. But homeopathic nosodes are made from diseased products. However, they're prepared and diluted homeopathically and energetically so that they have tremendous preventative and therapeutic properties. So I'll often, when animals come to me as puppies, I'll offer the option of parvo nosodes or rarely distemper nosodes instead of the vaccination. And I found that animals, when they're given nosodes, they often are protected as well, or if not better, than animals that are given vaccines. Finally, we want to focus on diet and food. And that's very, very important as an alternative to vaccines because let food be thy medicine, as I mentioned last time. And diet is the cornerstone of good health and will do tremendous benefits on improving the terrain of the patient and lessening susceptibility to disease. Energy medicines like homeopathy or Chinese medicine lessen susceptibility as well by raising the vibration of our animals and therefore allows them to be more resilient and stronger and less susceptible to disease. And then we don't have to rely on injected infectious disease chemicals such as the vaccination process. So in this brief talk, I've outlined the history of vaccination reactions. I've gone over what is a vaccine reaction, so you're more aware of what to be mindful of. I've talked about what, if any, we should consider vaccinating our animals for. And I've talked about treatment points on how we can protect our animals, both in a preventative way, as well as in a therapeutic way, if an animal develops illness from vaccines. If you'd like to consult with me, again, I'm available by phone nationwide. I see patients here in the West Palm Beach area, and I'd be happy to help you if you feel that your animals have been vaccine damaged or if you want to just prevent vaccine reactions. Thank you very much.